Getting in dentistry is one thing, but getting into a dental residency program is another. And there's a way to do it. Stay tuned as we talk to a D4 who's just got into his next step of his career, a dental residency. Stay tuned. Hey, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin. On the New Dentist Podcast Show, we talk about getting into dental school, getting into dentistry, and then life as a new dentist. Guys, make sure that you are subscribing. Make sure that you are commenting. Make sure that you are liking and sharing. Sharing is caring. Sharing this information to your colleagues, your friends, and those other pre-dental students that are looking to join us in this profession of dentistry. Also, this episode of Ask Dr. Darwin is being brought to you by GetIntoDentalResidency.com. GetIntoDentalResidency.com. It is a resource for you to help you get in and match and prepare you to match into your residency program of your dreams. For more details, go down below and check it out. And hopefully we can help you for this next cycle, so that you can get in. All right. So today we're joined with a D4 student Dr. Donnie, who's getting ready to graduate very, very soon, and he's getting ready to get to his next steps after his career. So how you doing, man?
Doing real good, man. Thanks for having me today.
Oh, absolutely. Absolutely. Well, before we get started completely, I want you to introduce yourself for those that are meeting you for the first time.
Absolutely. My name is Donnie Wiggins. I'm originally from Cleveland, Ohio, and right now I'm at Tufts University, finishing up my dental school career and moving on to the next chapter, which I'm excited about.
Shout out to Tufts and all the great things that the school has been doing over the years, and the recruitment, the retention, and the graduation of dental students, especially that look like us. It's been a big project up there for getting a lot of students into the field of dentistry. So shout out to all the folks and all the recent graduates and the getting ready to graduate. Graduates and stuff. So let's dive into. So why dentistry? Why did you pick dentistry?
So I was actually exposed to dentistry pretty early in high school, where I had this vocational program as an opportunity to me, where half the day I would go to high school, and the other half I would actually go to dental assisting school. And so I had a pretty early understanding as to, what dentistry can provide to a community. And I definitely liked that aspect of it, the service that was provided in terms of dentistry, and also the relationships that I could build with patients. It's a very people-centric business, and that's what I loved about it. And I was really good in the program. I did really well in the program. So I had an early iteration as to, the combination of providing a service, and also being successful at that. And so that was my early understanding of it. And, as I went on and had more understanding of what dentistry is, what it can provide, and my curiosity only grew. And so I think that has carried me and my passion in dentistry, in terms of, what I can do as a clinician and as a provider. So early exposure for me, and it's been up since then.
That's great. Well, looks like you're going to be going back up into New York really soon with your residency. And we'll talk a little bit more about that as well, as to programs and other programs that you picked, that you selected to go to. But also, let's talk about why residency, right? Because this is probably one of the questions that a lot of D4s every year go through in their mind, right? Why should I do a residency? Especially when I feel like I've got the tools, I've been prepared, from school pretty well. And due to the fact that, I got $400,000 of rent. I mean, not rent of of bills of
that
debt.
too almost.
yeah. Depending on where you are, it could be
Right.
$400,000 worth of rent. But so those are the types of questions that kind of get people thinking. Do I want to spend the time to do a 1-year residency, and versus and how that'll affect my money making potential by not working a year earlier. So to share a little bit about why you decided to do a residency.
Yeah, definitely. So, I mean, residency, isn't for everybody, right? Like, it depends on what you want to do personally, what your goals are as a professional, as a clinician, and also what your experience was like in dental school. The experience varies throughout the nation in terms of what you're exposed to in school. Do you have specialties there? Do you not? Do you get to do these specialty procedures? Or do you get to shadow or assist these procedures? And so I think a lot of that and the personal experience in dental school goes into a lot into that decision making. For me personally, at Tufts, I think it really came down to my experience and what I was exposed to. At Tufts, there's every specialty there: perio, ortho, oral surgery, peds. And so I got exposure to those things, but I didn't get to do a lot of those things hands-on. And so that's kind of what guided me into wanting to get more experience in some of these procedures. And even going back, I didn't even know what GPR or AEGD was, before I got into dental school. I thought you went to dental school and then if you specialize, cool. And if not, you just go and practice.
And that was the way. That was how it was done back in the day. For the most part, unless you were you were already part of like the military, and you would go back into your military service now as a dentist, and you would do a quote training program after. But you're right. That's typically been the case.
Yeah. I mean, that was my understanding too. And in the height of COVID is when I really started hearing those buzzwords GPR, AEGD, in terms of like that general residency. And so I started I'm like, oh, I'm asking fourth years at the time when I was a second year. I'm like, oh, what is this? Like, why are you doing this? What is this? And so they were telling me, basically it's a 1-year program for additional training. And, that varies, across the nation. And so in the height of COVID, and patients aren't coming, school is closing. A lot of our experiences were diminished because of, some of the side effects of COVID-19, and what was happening there. And so that limited our exposure even more so, in terms of being in person, seeing patients, what our requirements actually are in the clinic. And I just knew personally I wasn't going to be prepared, or at least at the standard that I want to be when I get out of school. And so that helped dictate my decision in terms of doing a residency. I knew I wanted to do more. I knew I wanted to see more. I knew I wanted to be more. And so that allowed me to make that decision very confidently.
That's good. And you're right. That will change for everybody, right? It's a personal experience, personal decision based on your experiences. So that will definitely play into people's decision as well.
Right.
Also keeping in mind that it's a great opportunity for you for the first time in probably 8 years to get paid to learn.
Right. Right. And honestly too, the pay aspect of it too is a whole different realm of decision making. People are like, I've done enough school, I'm ready to go into the workforce and get paid. What I'm saying? and to each their own. Like if that's what you want to do and that's going to get you to where your goals are, your goals are set, then cool, do you know what I'm saying? But I saw, that extra year of education and like a pay cut. I felt like that experience is going to pay for itself. And for me to have never been paid a salary in general, I'll take half of what a dentist is making, and get paid less to learn more, and hopefully that will carry me more.
Right.
It's really, I see it as like an investment, really.
Good point.
I've come this far.
Good
I've
point.
spent this much money on school.
Yep.
I'll take a pay cut, and that extra year is an investment.
And keep in mind, it's a pay cut, but it's not a pay cut because you haven't made that money before.
Right, exactly. That's a lot to me. It's a lot more than I've ever made. So, I was happy and right there.
Plus, it's going to put you in a position, and we're talking about why residency. It's going to put you in a position to be able to not only command more money, but also produce more money and more services and help more people at a level that you're more confident and competent as well, all based on your experiences.
Exactly.
Based on that 1 year of training that you're going to get, where you're going to be seeing more than 3 patients a day.
Right.
Like you do in dental school.
Right, exactly. That leverage power, right?
Yeah, because the way the dental school is set up as far as patient delivery of care, it's not efficient. It does not prepare you to see
not even
10 to 15 patients a day.
Right.
No. So great reasons why doing a residency for you. So let's talk about, before you can do a residency, you got to start that application. Talk a little bit about how you prepared for the application, some special things that you did too.
So in terms of preparing for it, I kind of looked at it like applying to dental school, which a lot of it, there's a lot of relations between applying to dental school and applying to residency in terms of personal statement, getting your letters aligned, your resume, or CV, and those types of things. And so I knew that going in because we were presented an opportunity of, asking some questions from a panel of previous applicants from like that most recent application cycle. And so after hearing that, that helped me organize my thoughts in terms of how I want to go about doing these things come my time to apply. And so I knew too that I didn't want to stress out about anything. I wanted to be early. I wanted to be very meticulous. I wanted to be incremental and intentional about everything I was doing. And when it came to applying. And so, like I said, I started early. I was asking people who previously applied a bunch of questions in terms of, how do I go about asking somebody for a letter? What's a dean's letter? I didn't even know what a dean's letter was. I thought I had to go to the dean and be like, can you write me a letter? And so, asking these questions and not being shy and not shying away from, former relationships from people who just got accepted, to know really, really just for them to give me some game about how to go about it. So after I got that and organized my thoughts, I started organizing my letters, and my letters were basically based on my experiences in school. I did a lot of research, so I had some letters there. Also, my curiosity in terms of, some of these specialty programs that help curate some relationships there. And also, I wanted to differentiate myself from the beginning. As soon as I got into dental school, I knew that. And so some of the projects I did personally, on top of the extracurriculars in school, I did some personal projects. And that helped me stand apart on my application as well, from D1 to D4.
Right.
So that helped stand apart. And also it was easier for my letter writers to write about me because I had different things to write about other than, oh, I see this person in clinic, they can do a crown prep, things like that, those normal things that people write about.
Yeah, and keep in mind, those of you that are watching and listening, that that the game on getting those letters, and the reason why is because your program directors and those that are interviewing you want to get a little bit more understanding about you as an individual,
Right.
right? Because we all know as program directors that there's different levels of being able to be a technician chairside, right?
Right.
And that's just one aspect. But that's the reason why you come in to do residency, so that you can become more proficient and efficient and learn some additional tips and strategies to deliver care efficiently chairside. So we know that already, but we don't know about you as an individual.
Right.
So that's why those letters of recommendation are really important, and it's important to have that information in there. So you guys trying to get your game together, trying to get up on game, like student Dr. Donnie mentioned. Uh, Rewind, play that little tip over again. All right, play that back, because that's how you stay on game with regards to getting ready for your application. So next is, you got your application together. Now you've got to get your programs, schools, locations,
Mm-hmm.
and you have to make some decisions about why you're picking those. So talk a little bit about your process that you used on how you proceeded to select programs, GPR programs, AEGD programs, and why those programs as well.
Right. So, when it came to that, I broke it down first and foremost by, where I want to be, like the location wise. Um, and so, I'm from the Midwest. I'm from Cleveland, so I wanted to be somewhat close to home, but I didn't want to necessarily live back in Ohio. I've had my time here in Massachusetts, in Boston. Um, and even when I came here to Tufts, I originally had the idea of being able to network in New York, because I thought maybe I wanted to be there. And so, kind of reflecting on a lot of things allowed me to help curate my list in terms of location. And then in terms of programs, man, they vary from the best program to, like, a program that you're doing very minimum. Like, it varies so much throughout the nation, and it's hard to get a lot of this information online. Some of these websites are very outdated. They're the last time they put something on their website, was 2008. um and so there's a lot of information lacking online, and so it comes back to, not being shy, and getting game from people who've been there, previous residents, reaching out, even like, student doctor network, different forums and things like that, just finding information any way you can and forming relationships any way you can. And so that kind of helped me, and directed me in terms of, what these programs were actually experiencing, and what they were providing. And also, I had to break down to myself. I'm like, what do I want out of a program? Like, what experiences do I want? What kind of clinician do I want to be? Um, and so based on those questions I asked and answered to myself, that allowed me to look at different programs and say, okay, they offer, implant placement and oral surgery procedures and perio surgery. Okay, I like that program. Check. This program offers a lot of peds. They don't do a lot of prost. Maybe that's not something I'm looking for. And that I got that information based on the relationships I was forming with previous residents. Reaching out to admin at the programs. Even some program directors took the time to, reach back to my emails that I sent out. And so in dentistry as a whole is really a people business, and it's a lot of it is based in relationships. And so I took that to heart, and I was very intentional with that. Not to say I was using people, but I knew, I love talking to people. I love talking about dentistry. I'm an entrepreneur at heart, and I let that carry me in my conversations. So that helped me pick, or help me make my decision in terms of what program I wanted.
Yeah, that's all of that is important. That networking and using your resource, right?
Yeah.
I always say the smartest student dentist person in the room is the one that asks for help,
Right. Exactly.
right? And not be shy
Right.
about it because it's important. It's part of your it's part of your it's part of your responsibility and your obligation.
Right.
Completely. Completely. So let's talk about the interviews. Uh uh I'm sure you probably had a list of schools and programs. How many programs did you apply to?
So I ended up applying to 10 programs, mostly in the Northeast, Midwest area. A couple non-match, a couple match. And honestly, I would have applied to more, but it was just like it was money, honestly. It's expensive. Just like applying to dental school,
Yeah.
it's expensive.
Yeah.
Um, so that was what it was, but that made me have to make sure that these programs were exactly what I wanted. And I didn't shy away from any programs that, maybe I won't get in here, maybe not. I didn't shy away from any of that at all. It was like, what do I want out of a program? Do they have it? Do they check the boxes? Cool, I'm applying.
Yeah.
And it really, there's a lot of, like I said, there's a lot of commonality and applications on paper. But I knew, for me, I was like, just give me an interview, just give me some FaceTime, and like you'll be able to tell, my intonation and my conviction and how I present myself and who
Yep.
I am in my story. I'm different than the other person that looks the same on paper.
Yeah, and that's the key. That's why you put that application together so that you can get to the next step, get to that interview step so that you can get that FaceTime,
Right.
right? Get that
Yeah.
FaceTime, which is so important. So interview wise, how many interviews did you end up getting, and what about the interviews did you not expect?
So I think I got around like 6 or 7 interviews, both to the match and non-match. And a lot of it was your typical interview, why residency, why this program, tell me about yourself. And so that was pretty typical. Um, but some of the things that stood out to me in the interview process, there was some unique ways of, getting people out of their shell, in terms of, I had one interview where, they were pulling random questions out of a hat and, asking people in like the group part of the interview. And one question I had, or I guess it was like more of a demand, I guess. They were like, tell us your best knock knock joke. I was like, oh man, come on. And it truly caught me off guard too. And it was one of my first interviews. And so I think too, when it comes to those types of questions, it's not really the answer per se, but more so how you go about, responding to something that you weren't expecting.
Communication.
Yeah, yeah.
Communication, because you already know what's going to happen. You probably
Yeah.
have already had it. Seeing patients.
Mm-hmm.
Patients ask you a question that you weren't that you
Right.
didn't expect them to ask, right?
You're like, wait, what?
Right. Do I have to pay for this?
Yeah.
Or am I gonna be able to eat tonight?
Mm-hmm.
Or can I still see you as my doctor after you graduate?
Right.
Just anything,
Right.
Questions that people will ask that you have to be there face to face
Mm-hmm.
and think without them seeing you think, and be able to deliver and communicate and say, Miss Jones, I would love to see you afterwards, after I graduate. I'm going to be moving to Brooklyn or
Right.
California or Texas or wherever. And as soon as you let me know that you're coming, we will definitely reconnect.
Yeah, right.
However, I am leaving Boston.
Yeah, right.
I'm leaving
Right.
Boston, but we can stay connected through email if you do have any
Mm-hmm.
questions. It's just something off the cuff like that,
Right.
and just how you deliver it and share it with the patient. So that's
Mm-hmm.
why that knock knock joke guys was
yeah, I
was
mean,
a good gem.
Right. Yeah, you got to be prepared for anything like that, in terms of just like you said, communicating yourself and being able to think on the spot.
Yep.
And so I had things like that that were very interesting. And I also, in terms of my personal application and some of the interviews, I did a lot of different things outside the realm of school, but also related to dentistry in a sense. I did a oral care recycling program that I started. I'm making a biodegradable toothbrush right now. I have a lifestyle athleisure brand called Better Health Club that I'm wearing right now, and so I put that on my application because these are things that I'm advocating for, the environmentalism behind the health industry and all the waste, and also building community with the Better Health Club initiative that I started, in terms of better health practices and just being better at whatever we can be, better people, whatever. And so that helped, or at least in the interviews, they asked a lot of questions about that. And so when you differentiate yourself like that, it's something to talk about. It says more to you about you than that A you got in pros in pre-clin, or that grade you got on that endo exam.
Right.
It just says more. So that we talked a lot about that in my interviews too.
Good. So after your interview, you've got to go back, look at your notes, and you've got several weeks depending on when you have your interviews. But there will be 1 week where you have to put it all together and come up with a rank list. Now, keep in mind, you had some non-match programs.
That's right.
Which means you potentially could have and did receive some offers probably within first 48 hours after you interviewed.
Yeah, that was the tricky part. I did get some acceptances. Like that next day, I got the call from these programs, because with the non-match, it's like, you interview, and if they like you, they'll accept you like on the spot or the next day. And so I did get some acceptances like that, and they were pretty early because you submit your match in January, and match day for at least this cycle was January 24th. Whereas I had interviews for some of these non-match programs in November and getting acceptances in November. And so I'm like, I got all this time until match. And, I had to take a calculated risk when it came to, maybe not denying these programs, but saying, I really loved your program. I love the opportunity that you guys provide. I can really see myself thriving here. But as it currently stands, I'm just gonna, wait to see how a match goes, and take my chances there, in a more professional way, of course.
Absolutely.
But yeah, I had to take that risk and say, and bet on myself essentially, because match, you never know how it's gonna unfold at all.
You don't.
And so it was a risk. It was a risk.
So based on the fact that you took, you knew that you were taking a risk, but it was a calculated risk.
Yes.
And you put together your rank list. So just share what led you to put certain programs in certain orders after you had all your interviews.
So for me, the places that I ended up ranking were all very similar in the sense of what they provide in terms of procedure experience. So it really came down to relationships, as I keep touching back on. I had formed relationships with people at Kings County, in and out of Kings County in Brooklyn, New York. From the top to the bottom, and in between.
Were there other tough residents that had completed the program, or they were there?
Yeah, there were other Tufts residents there currently. I had touch base with a couple dentists in New York who had gone to King's previously, you know, and who knew people, you know, and so the relationships definitely helped in making my decision when it came to ranking.
Yep, that's good. That's good.
And,
All right.
know, not everyone does that, so.
Drum roll, drum roll, drum roll. Cue the music here. Cue the music. Hey, hey. Boom, 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 boom. All right, so where are you going to be taking your talents to in July?
So come July 1, I'm going to Brooklyn, New York at Kings County Hospital for a 1-year GPR residency. And I am excited. Thank you.
Congratulations. Brooklyn represent.
Oh, yeah.
Brooklyn.
Yeah, I'm super excited, man.
That's great, man. Congratulations.
Thank you.
Congratulations.
Thank you.
Congratulations. You matched.
Feels good.
That's good, man.
Yeah.
Let's talk about match as it relates to what others can do so that they make sure that they can match as well.
Mm-hmm.
Share some tips, advice, knowing what you know now, the process that you've gone through. If you were talking to your little sib, a D3 that's part of your team, your pod up at Tufts, and as they're getting ready to apply for residency programs, what are 3 things that you would tell them first and foremost about getting into residency and preparing for it?
Man, so honestly, the typical be early and be organized. You know, that would be my very first tip when it comes to that. You know, I feel like because I was early and organized and intentional, that allowed me in some doors before some other people, in terms of, you know, having my letters in place and getting interviews and things like that. So just being prepared is the first thing. Second thing is just being open-minded and not being shy, and just putting yourself out there to form some relationships with people who've done it before and who have seen, you know, the good and the bad of the whole process. You know, there's a lot of anxiety and angst involved, you know, so just putting yourself out there and forming those relationships and, you know, just letting them know who you are. And the last thing, honestly, would just be like, you know, don't stress out about it. You know, whatever is meant to happen is going to happen. You know, even if you don't get your top choice, you know, even if you don't match, there's a lot of opportunities out there, you know, for you to go about what you want to do, you know, in a different manner. You know, it's not to say that, you know, you won't do well if you don't match, or if you don't match in your top choice. Like, opportunity is opportunity, you know, and take it as it is, and don't beat yourself up about it. Those are my tips from Donnie Dental.
Donnie Dental, and that's a great segue to to people being able to contact you if they have other questions or just want to link up or find out more about your experience. What's the best way for them to contact you?
Yeah, so if you do have questions, you guys can reach out on my Instagram, Donnie Dental, at Donnie Dental. You can also email me if you want, teethstudios.asi@gmail.com. I'm open and willing to help. I'm willing to chat, anything really. I'm very open, so reach out. Don't be scared.
Don't be scared. Don't be scared. Your future and your livelihood depends on it, so you ain't got time to be scared.
Absolutely.
Reach out to them, guys. Hey, guys, I hope this has been helpful. Student Dr. Donnie, getting ready. The countdown is on for you to become Dr. Donnie officially.
Yes, sir.
And so excited for you, so happy for you. Have fun in Brooklyn.
Thank you.
And most of all, thank you for sharing your experience and your time. Guys, hopefully check out these next videos here, and hopefully these will help you during your time in this process as well. And that's our time for today. Love, peace, and smiles. And we'll see you next week. See you on the next video. Peace.
Appreciate you.